Well, we touched briefly on Medicare, what happens if a claim is denied after an appeal. Our guests are Medicare experts, Catherine Sevier from AARP North Carolina, Steve Edmunds from Alliance Insurance Services. Let's just start with this. There is a common misconception that you only sign up for Medicare if and when you need it. What do you say to that, Catherine?
I say that's a big mistake. You must sign up when you turn 65.
What happens if you don't?
You pay a penalty, and it is a penalty for the rest of your life. So you must sign up 3 months before, 3 months after, or the month of your birthday.
All right, yeah, let's kind of look at that timeline just so everybody really gets it. Steve, let's talk about that. Because you have to sign up at 65, no ifs, ands, or buts, and that's because that's what the government says. You have basically a 7-month window.
You do. You have 3 months before your birthday, the month of, and 3 months after. So, and we were just talking about before we went on air tonight, a lot of people are working longer and they're working past age 65. So you can actually defer Part B, but Social Security needs to know that you want to do that, So irregardless of whether you need Part B at age 65, and you're almost always going to take Part A because it's free. So you're going to sign up for it irregardless, even if you're still working. But yeah, do it during those times when you're turning 65, and that way you can always work on what you need to later. But Social Security needs to hear from you when you're turning 65.
All right, so no doubt those answers are going to bring up some questions for those of you at home. We'll be taking some text questions a little later in the newscast. So the number to text your question is at the bottom of the screen, 336-379-5775. All right, so Catherine, let's just talk about this because he just mentioned Part B. Let's go over what Part A does and what Part B does.
So Part A is your hospital stay, simply put. If you go into the hospital, Medicare Part A pays for that. Part B is almost everything else. It's your office visits to your doctor, it's your lab, it's your physical therapy, it's mental health counseling, it's all that outpatient stuff. Some people don't choose to take Part B when they are still working. They have a coverage that will already pay for that, so they defer it until they retire. But if they don't defer it, and they don't take it, they have a penalty that will stay with them for the rest of their lives, and it's 10% a year. So it is steep and it is yours.
All right, so we want to be very clear about you have to sign up when you're 65. Even if you're still working, you can defer Part B, but you have to sign up and defer, otherwise you're going to get that penalty. All right, so we know you probably have a few questions. You can send in your Medicare questions, 336-379-5775. We've got these two experts here. They can answer them. We're going to be taking a few questions right after the break.